Ask any new mom and she'll tell you her goals for her baby are pretty straightforward. Make sure that baby is comfortable, eating well, sleeping well, and absorbing all the nutrients that they need to grow and develop properly. But when onesies, bibs, and mom's shirt constantly get soaked with spit up after every feeding, it's hard to feel like that development that they're going through is common and normal. Some infants are given the term happy spitters with slight reflux symptoms, but far too often that's not the case, and the reflux is accompanied by colic, sleep struggles, straining and arching the back, and constant vomiting, all of which leads to a very fussy baby. This is exactly where Colton's mom was at. She said, "We tried a handful of formulas and none seemed to work. His reflux would get him so worked up and we couldn't get him to sleep more than 2 hours at a time. I felt frustrated and at times hopeless that there was nothing I could do to comfort him." Reflux can be worrisome for any parent, which is why we want to discuss the alternative options to help with reflux, especially if you're looking for a medication-free option. Because what causes reflux and why it can be mistaken for a structural or nutritional problem when it's often rooted in something deeper is often overlooked. I'm Dr. Rachel, a pediatric chiro at Sprout Family Chiropractic, and after seeing baby after baby with reflux, we find that reflux is actually rooted in the autonomic nervous system and the areas of the brain that controls upper and lower digestive function. To get to the root cause of reflux in kids, we've got to look deeper into the nervous system and how it's growing and developing, looking at structure, neurology, and nutrition. Structurally, there's a muscle called the lower esophageal sphincter, which acts as a valve between the esophagus and the stomach. When baby swallows, it relaxes and allows food to pass through to the stomach, but normally it stays closed. If the lower esophageal sphincter isn't fully developed, or if the brain signaling to it while swallowing or not swallowing is not fully in sync, then it can stay open, which allows the contents of the stomach to come back up through the esophagus and mouth. Neurologically, our digestive system is made up of nerves and muscles that work in coordination with each other to help things move along. If the neurological control of the smooth muscle that makes up the esophagus is interfered with, reflux symptoms can follow. It's easy to mistake reflux for something that's nutritionally off. And while nutrition may be the case some of the time, what we tend to see is that if the various systems that control eating, breaking down food, and absorbing it aren't fully in sync with one another, then there may be another factor at play with a condition called dysautonomia. This simply means that the autonomic nervous system is having trouble keeping the eating, digesting, moving, and breathing all happening at the same time. This is why even if you've changed formula multiple times or even changed mom's diet, it can seem like nothing's helping. When this is the case, babies will often struggle with eating comfortably and keeping down food easily because their nervous system will prioritize breathing and moving over digestion. It may seem serious to label a struggle as neurological, but when we really dig deep into how babies develop and how they need to put everything together all at once, it starts to make sense that if one signal is off, it can lead to a cascade. When we look deeper at the autonomic system, we see a vast interconnected network of nerves that need to communicate appropriately with one another in order for comfortable digestion to happen. Now, when there's a misfire in this interconnected network due to something called a subluxation, then swallowing, digestion, absorption, and comfortability in that region is altered. Let us help you find the root cause of what's going on. Our team can put together a care plan and make the safe, easy, gentle adjustments to help unwind that stress and tension in your baby's nervous system from pregnancy and birth. The nervous system very often is the missing link in making upper digestion happen with ease, especially in infants and babies. As always, please ask any questions you may have by leaving a comment below or sending us a message. And secondly, we know so many parents are struggling with what more they can do to help their little ones with reflux. So please share this video with any moms, dads, parents, Facebook moms groups who need it. We'll see you in the next one.